Hello, I'm Dr. Sandra Cabot. Welcome to my webinars where I share information to give you knowledge and clarity to enhance your health and well-being. I've been a medical doctor for over 50 years and I know that knowledge is power. So let's go. Hello, everyone, and hello to Igor Pershin. Good to see you, Igor. Are you there, Igor? We're having a few technical problems.
Oh, here we go.
There you go.
Hi.
Okay. Well, it's good to see you, Igor, and
Good to see you, Sandra. Sorry about that.
thanks for your time today. It's a beautiful day outside, and we're talking about how to detox your mind and your body because we live in an environment which is becoming increasingly polluted. And people are very aware of all the chemicals and plastics that are around us in our water, our food, our air, and how we can reduce our exposure to them and how we can help our liver and our gut to increase the elimination of these toxins once they get into our body. So this is a very, very important subject. And we'd love to get some comments from anyone there who's listening to us. Any questions you have, we would be able to answer them for you because we've been studying this area for many, many years. So, Igor, let's look at the program that you have to help people detox their brain. And first, you might want to explain, what a overload of toxins in your brain can manifest as.
Sure. So firstly, I'll start with sort of segueing on from the health side of things. So we talked about this last week. So if you want to dive more deeply into toxins in water and specifically microplastics, please go back to last week's episode and you can hear us talk in depth about that. Yeah. So, one of the hats I wear is the founder of Natural Filters, which are charcoal water filters that absorb chlorine and heavy metals and balance out the pH, improve the taste of your domestic tap water. It's something that I came across through my own health journey of removing microplastics from my kitchen. I'm quite passionate about them. But specifically, another one of the hats that I wear that I'll be focusing more on in this episode is what is known as My Weekly Dash. So it's basically an online personal accountability platform that I've developed originally for myself. And then I realized it's something that could really benefit people. And I've also expanded this to offer coaching, mindset, NLP coaching specifically. So how do we detox our mind? First of all, we need to clear the clutter. Throughout our day, we just get overloaded with tasks and responsibilities and worries, regrets about the past. I should have the old something we say in our coaching circles, shoulda this and shoulda that, and we shoulda all over ourselves. We got to avoid doing that because it implies regret. So I've been actively trying to remove that from my vocabulary. Instead of should have, I replace that with could have. This is something I could have done because it doesn't imply regret. And ultimately just moving away from that perspective. And that's so a way you can do that is really just to look at what can you actually control in your life, things that you're worried about. So for example, war in Ukraine, like I could spend all my day worrying about it, but I have to ask myself, okay, is it something that I can control? No, not at all. Is it something that I can do something about? Okay, maybe I can contribute to a charity that's helping victims in Ukraine. So if I can do that, great, I'll do that. And then move on to things that I can actually control in my environment. So my room's messy. Okay, I can control that. I can clean it up. So that's really needs to be the first thing you can do when it comes to detoxifying the mind is figure out what you can control and do something about it, and then let go of whatever it is that you can't control.
Yes,
And then
that's very good wisdom for people, because if you can, it's really about living in the present moment, isn't it? And not having a mind that is too busy and distracting you, but trying to focus on the present moment and do something positive with that. And it's the little steps that you take that accumulate and bring great results.
Yeah, definitely. And yeah, so, and also talking about like, yeah, the one of the keys to living in the present moment is also, it's great to look forward to something, but if it starts consuming your whole life, if you're just living in the future, like Alan Watts talks about, the future is lost on people who are living in it because they're missing what is happening around them. You know, if you're
Yes.
always like looking forward to something and not being present enough to smell the roses, so to speak, then it's kind of the present moment. The beautiful gift of life is lost on us. So we really need to bring ourselves into that moment.
Exactly. Yeah. Well, we have somebody there, Minnow. Hi, Minnow. She's said hello. It's great that you've joined us today. And yeah, looking at how people can improve their environment. We've talked about microplastics, how ubiquitous they are, and what we can do to prevent them getting into our body. So choosing to drink water that has less microplastics is very, very important, and your water filter can help with that. Reducing heavy metal exposure is very, very important, and your water filter that. And just being aware of your food, like when you buy food from the supermarket, is it wrapped in plastic? And if it is, well, you remove the plastic, but then you need to scrub the vegetables and the fruits that have been wrapped in the plastic. Scrub them and get rid of the plastic. And if you are drinking water, don't drink it out of a plastic bottle. Use a metal bottle, because these microplastics, once they get into your body, they will accumulate, and particularly in the brain, and that could help, actually would reduce your ability to have efficient neurological function, because the plastics will accumulate in areas of your brain that's involved in communication and thinking and emotions. So reducing that exposure is critically important, and it's really something that people don't have enough awareness about. And we were saying it's those little steps that you make that really make a big difference. Don't you agree?
Yeah, definitely. Yeah, thanks for the recap, Sandra. It's
Yeah.
so important. And yeah, so I'll move on to the second section, which is release emotional toxins. So this is something that's more of a more at the subconscious level. So sure, it's good to be able to live in the present moment consciously. However,
Yes.
ultimately, most of what happens in our minds is at the emotional level, which is at the subconscious level. So this is something that is arguably much harder to do, and this is something that can be achieved through many methodologies. At the end of the day, it's ultimately what emotions are we holding on, and these holding on to, and these are often things from our childhood, which is our subconscious is formed from birth until about 7 years old. So just because it's formed then, it doesn't mean we can't release it. We can. It just takes more time, and you may need the help of someone. So something I offer through my coaching, through timeline therapy, is really helping release those deep-seated emotions. Through my own personal journey, I actually plant medicines were very powerful in helping me release those subconscious emotions. But now that I've learned with timeline therapy, I realize that you can actually be done through that as well. So these are, yeah, like the key emotions that we often hold on to from our childhood are anger, sadness, shame, guilt, and fear. And
Yes.
we often allow these to run our lives and be in fight or flight, which is ultimately, as you know, Sandra, leads to long-term chronic stress, and then can cause a whole host of disease, dis-ease when we're out of ease, such
Yeah.
as autoimmune conditions, all sorts of things.
Hmm. That's right. Well, the subconscious mind is so powerful, and as we say, it's subconscious. You're not really aware of the huge influence it has on your behavior. And, I recently had a discussion with a lady who's a professional woman, and she said to me, well, I've always had low self-esteem. I've never really believed that I was valuable or worthwhile. And this came from her childhood. And I said, well, that's your self-image, and it's actually fake, because the real you is perfect. Um, you need to know the real you, and there's techniques that enable you to know who you really are. And it's even deeper than the subconscious. It's the energy that sustains your life. And so I said to this lady, you just need to forget that self-image. It's fake. Low self-esteem is your idea of yourself. It's not the real you. It was what was imprinted on your subconscious as a child. And so it's all about living in the present moment. And it's like shedding an old coat, isn't it? And underneath is something new in the present moment. And it's fascinating, the subconscious mind. And it goes back to that famous neurologist and psychiatrist, Sigmund Freud. And he first talked about the subconscious, and he enabled people to get into their subconscious through hypnosis. But it's that self-awareness, people are just not aware of who they really are. And, to get rid of all those fake concepts in the subconscious, which really hold you back, is critically important if you want to be successful in life, in enjoying life and achieving your goals. And I know
Definitely.
you help people with their goals, Igor, which is great.
Yeah, I mean, limiting beliefs can really hold us back for so long, possibly our whole lives. We've got this beautiful gift of life that we're given every day that we wake up, and we often allow these limiting beliefs like I'm not good enough, or I'm not worthy, or fear of success or fear of failure. So, for example, with my own journey, one of my most recent major limiting beliefs that I've shared in the past year has been this idea that I can only make a comfortable living through digital marketing, which I'm no longer passionate about. I'm far more passionate about helping people, realize their true potential through coaching, through the software tools I develop. So that was a limiting belief, and now I've replaced that limiting belief with an empowering belief that I can make a comfortable living for me and my family through anything that I put my focus on. And that was thanks to the tools of that Tony Robbins highlighted, which actually got me on the path of NLP, which was the Dickens method. It was a really powerful tool that really works on a subconscious level. It's kind of extrapolating, okay, if 5 years from now and I've still got that limiting belief, and I'm still living that life, then how do I feel? Like really visualizing what that looks like from every aspect of your life. Like, what does my wife think about me? What do my kids think about me? Like 10 years in the future, what does that look like? 20 years in the future? Like, it actually brought me to tears. So and then once I came out of that, then I looked at the alternate pathway of what does that look like if I shed that limiting belief and replace it with an empowering belief? What does that future look like? My ideal future in 5 years time, 10 years time, 20 years time. It's a really powerful technique. And yeah,
Right.
so yeah.
Yeah, giving people that awareness that their potential is so huge, but you've got to get rid of the limiting beliefs, and they're so deep in your brain and your subconscious, and it's just practicing how you can see yourself in a new perspective, in a new light. It's very empowering.
Mm.
Yes.
And something like that, like if anyone's would like to do that, but perhaps they're not ready for coaching, or they don't have access to it, then something that they can already start doing, anyone can start doing, is to actually bring awareness to your own limiting beliefs through journaling. That's something you can just start with, like 5 minutes a day. Once you get into it, you'll find that actually you end up spending more time, because it's a way that we can release these limits and actually bring light to them. Because once you bring these limiting beliefs to the light, you realize how silly they are, how they don't actually represent who you are at all.
Yes.
So that's sort of a regular process of journaling. The
Yeah.
last one, sorry, go ahead.
No, that's okay. You continue. Yeah.
I was just going to say, once you're able to sort of go through those, to bring yourself in the present moment, clear away what isn't, what you don't have control over, and once you're able to release the emotions that are maybe holding you back or burdening you down, and the limiting beliefs and limiting decisions as well, then the third stage is actually to really rebuild. So get clear on your purpose, and purpose is not necessarily a lifelong thing. It can be specific to your phase in your life. And
Yeah.
that's something that I still check in, like, from time to time. Is my vision and my purpose currently consistent with what I want to do right now? So I check that maybe every 3 months and do a deeper dive every year. And then you look at your values. So what are your core values that are driving your decisions and beliefs right now? Usually I limit it to about 5, and then I see if my mission and my vision is consistent with those values that I'm trying to manifest. And then we basically use that to guide our long-term goals, and make sure that that's in balance. These long-term goals are in balance with different aspects of our life. So a tool I recommend that I do with all my coaching clients, that you can actually do for free at home, is basically the wheel of life. So it's like you draw a circle, divide into 8 pieces, and then you label each one for different aspects of your life, and then you give yourself a rating out of 5 or out of 10, depending on which one you use on the internet. And then you can see, okay, this is where I'm doing well. This is where I'm doing not so well, and the areas I'm not doing so well, obviously they're out of balance. So maybe I can use that to guide my long-term goals, and then you can break them down into weekly goals, and that's ultimately what I do with my weekly dash. And that's something that, yeah, people can try. I do offer, it's a 7 days free trial if you want to try that. But yeah, or you can just do it. You can just print it out. If you prefer to do it by hand, then you can do it by hand. Just Google Wheel of Life, and it'll tell you how to do it. Yeah, if people are interested in going deeper with the coaching, they can check that out there. And then I'm also creating a free Facebook group called the Limitless Living Collective, where people can join. And I'll be sharing some of these tools for people to use, and we'll be having like webinars, discussions. Yeah, it's just going to be a really nice community that if people are interested in joining, they can jump on that, and it'd be great to see you in there. And
The Limitless Life Collective. I like that. Yeah.
Limitless living. Yeah.
Right. Yeah. Stop focusing on the limits, because often they're fake, and you to focus on what you want to achieve. And it's the small steps, the little things you do every day that accumulate and really become very, very powerful. It's like your physical health. the little things you do every day, your habits, like making sure that you do some exercise, making sure that you're drinking enough water, making sure that you're getting enough sleep. That is going to have a big effect on your immune system and enable repair of damaged cells in your body. We're talking about detoxing, and some very simple things you can do would be try some intermittent fasting. So miss breakfast, and if you're not hungry, even miss 2 meals a day. Miss breakfast, miss lunch, but make sure you drink a lot of water. And that will put you into a state of mild ketosis, where you're actually breaking down fat. And when you break down fat, you're actually releasing toxins. So you could drink more water with some fresh lemon in it, and perhaps add some magnesium powder to keep your energy up. And that will stimulate a process called autophagy. And it's fascinating because autophagy is where your cells actually start to do internal cleansing. So the mitochondria increase in number and activity and produce more energy, and that enables your cells to break down the old structures that have become damaged through toxic overload and through the accumulation of metabolic waste products. So they're doing their own internal house cleansing, if you like. And then the macrophages, which are the little Pac-Man cells, come along and chew it up, and you eliminate this broken down metabolic waste through the liver detox pathways. So that's a simple thing you can do, is just think, well, today I'm going to miss a meal and just drink more water. And that is a really good way to detox all the cells in your body. Or you could throw in a few superfoods there. And we have a powder called the Ultimate Superfood, and that's got all your greens and your antioxidants. So you could stir that into the water, and it's got stevia, so it doesn't have any carbohydrate that's significant. And that would help your liver to break down the toxins and eliminate the toxins. Also, you could grow some broccoli seed sprouts. Now, broccoli seeds are amazing. So when they grow into a sprout, they produce a lot of sulforaphane. Have you heard of that? No. Sulforaphane is very high in natural sulfur, and that helps the detox pathways in your liver. And it helps your liver to make glutathione, which will protect you against the free radicals that are produced when your liver is detoxing. So you could have 1 or 2 handfuls of broccoli seed sprouts during the day. So these very simple and inexpensive techniques for eliminating toxins from your body really work, particularly if you do them as a regular habit. So, you can combine the mental detox with a physical detox. I think then you'll get a double whammy, if you like. You'll get a really powerful effect. And we have a 15-day cleanse program, and you can just Google 15-day cleanse, Dr. Cabot, and you can see that there is a powder that works on your immune system, your liver, and your gut to increase the elimination of toxins. So by incorporating the mental detox with a physical detox, you're really going to get excellent results. And after 15 days, you'll feel so much better. We've got a lot of testimonials on our website that people have felt this total rejuvenation of their emotions as well as their physical energy. Their bowel actions are better, their skin is better, they've lost a bit of weight. So using these natural methods which help your own body's physiology, your body's amazing. You know, it can get rid of these toxins if you provide it with the right tools. So it's quite a gentle detox too. You know, as people don't want to be sitting on the toilet all day or, you know, getting nausea and things like that. You do it gradually. And I think that's probably with your program as well, you know, working on the subconscious is not so stressful as, you know, confronting things all at once, but, you know, doing it more gradually and finding your own resources. You know, people don't realize how powerful they are, do they? They see all the problems overloading them, but they don't realize that within them they're incredibly resourceful if they have the right techniques. And that's what you're helping them to do, Igor, is understand those psychological techniques which are so powerful.
Yeah, definitely. It's something that so sorry, I've just got 100 things. I just got to organize my mind. I've got to, while you were talking, I had all these things I wanted to say. So first of all, to answer your question, 100%. So with the coaching program that I do, it's a 12-week journey called the Freedom from Stagnation. And we don't get into the timeline therapy until about week 5 and 6. So by that stage, we've gone through the life balance wheel. We've seen the wheel of life. We've seen, you know, where my clients are at in different parts of their lives. We've gone through and conducted like a detailed personal history to really understand where they're coming from with the emotional journey through our lives. And we've understood our core, done a core value assessment and seen what's driving them. Yeah, it's a gradual process. So this is why often people, you know, they'll go and do like plant medicine, and it's so overwhelming because it's just all at once. And through that journey, you're fully associated with the memory as well. So it can be quite traumatic if you're not guided properly. Which, you know, this is why I don't necessarily recommend it for most people, and unless you've got the money to go to an actual shaman in Peru. You know, don't get me wrong. There's some great plant medicine workers in Australia, but unfortunately, there's a lot that have just woken up in one day and decided I'm a shaman. You know, haven't gone through the actual training, which can be dangerous, and especially when it's not paired up with the correct integration after the ceremony. But yeah, that's why what I do with timeline therapy, it's very gradual and it's very much focused on their safety and comfort. It's when we look at a memory, when we're disassociated from it, so from an external perspective, from a third person, then it's much easier to deal with the emotions rather than putting yourself back into that moment. Which can be, you know, you're reliving the trauma. It's not what we want to do. So you're right. There's ways you can do that are far more gradual and far more comfortable, and also at the end of the day, far more effective. So I just wanted to add. So I appreciate you diving into fasting. I think fasting is fantastic. My wife and I have been going down that journey for the past couple of years, and we've seen some pretty amazing health benefits. Something that I've learned through fasting is a lot of the literature around fasting is actually tailored to men, and our hormonal journey throughout the month is pretty constant. You know, it's pretty linear. Whereas, obviously, you know, for women, it's definitely not. You follow the cycles, and something that I've learned through my wife and other people, that other women I know who tried fasting, it didn't work out for them, is you really need to time the fast to the stage in your cycle. So there's a wonderful doctor called Dr. Minnie Pelz, who wrote a book called Fast Like a Girl, which I've read several times, and my wife follows her recommendations around pairing the type of fasting that you're doing with the stage in your cycle. So I'd recommend people, women, check that out. If you've tried fasting, it didn't work out for you, or it can even have, if you do it to the extreme, you can even have some hormonal risks associated with that. So yeah, I'd highly recommend women check out that book and the recommendations.
Fasting like a woman, is it? Or fasting?
Fast like a girl.
Oh, fast like a girl.
Yeah.
Interesting. Yeah. Well, it's sometimes all you need to do is miss one meal a day. Doing extreme fasting can be dangerous, particularly in people with eating disorders or people with unstable blood sugar. You've got to get in touch with your body. If you're not hungry, you don't have to have 3 meals a day if you're trying to lose weight. But another interesting thing, is when people are detoxing psychologically, which you're helping them to do, that can bring up a lot of anxiety. And we have studies that show that the ketogenic diet is very effective for anxiety. There is a lot of evidence that the ketogenic diet reduces brain inflammation. And this can help people who do suffer with panic attacks, insomnia, and just that chronic subclinical anxiety, which really reduces their quality of life. So we know that too much carbohydrate can promote anxiety, and the ketogenic diet, being high in fat and protein, actually helps to balance the neurotransmitter production in the brain, reduce brain inflammation. So, a combination of fasting and ketogenic diet can be very helpful for people who are trying to detox mentally but find that it's producing anxiety. Because everything's related, isn't it? You're helping people to detox psychologically, but you've got to help your body to detox physiologically at the same time, and then you're going to get tremendous results.
Definitely. Yeah, the one affects the other. It's it's not a chicken or the egg thing. There's just a constant interplay between our mind and body.
That's right.
The gut one is really interesting. I remember reading about these studies where they found mice who were anxious, and then they found mice which weren't anxious, and they replaced their gut biome through a fecal transplant with the non-anxious mice, and then all of a sudden the anxious mice weren't anxious anymore, which is interesting.
Right. Yeah, your gut bacteria have such a huge effect on your brain, and when you do fasting, well, that changes your gut bacteria profoundly, and so there's less of the bad bacteria to produce the toxins, which can recirculate back to your liver and your brain and cause brain inflammation. So but it is the brain-gut connection which is so important. And when you think about the vagus nerve, fascinating nerve, the vagus nerve is the longest nerve in the body, and it travels all the way from the bottom of your brain to your anus, the end of your gut. And it innervates your heart, your lungs, your diaphragm, your liver, your gallbladder, your pancreas, your small intestine, your large intestine. And so your emotions will affect the vagus nerve, but the vagus nerve will also feed back to your brain. So that gut-brain connection is very, very important. And I think that's where meditation can help people too, because it's a breathing thing, and that's through your diaphragm, and that's going to help to regulate your vagus nerve. So that's helping your gut-brain connection. So with all those things, if we do them as a regular habit, they're going to be helping our gut microbiome, our vagus nerve, the gut-brain connection, and we can start to feel a little bit more in control of our own physiology. and reduce panic attacks and insomnia and all those awful things.
It's so interesting. I'm probably
Yeah.
going to get a thumbs down for this joke, but what happens in the vagus nerve doesn't stay in the vagus nerve.
Correct.
It flows on. But that's so interesting. I think, yeah, meditation is something that I actually last night I did a refresher for my transcendental meditation practice. It's something it's a tool I've been using for the past 10 years. And lately I've just haven't been very regular. So it's really good to have that refresher. But yeah, meditation is so powerful. At the end of the day, it's like, I heard this really good analogy that our mind is like an inbox, and one of the central tenets of neurolinguistic programming, NLP, is the unconscious mind all constantly wants resolution. It wants to resolve things. So often, what happens throughout the day is things will come in and they won't be resolved, and our mind will just put them in the inbox. Resolve them later. And then
Yes.
when we're when we're driving in the car, our subconscious mind's like, okay, resolve this now. And you're like, I don't want to think about this. And we block it out and we put on a podcast. And what happens during meditation is all of a sudden the unconscious mind's like, okay, here's your inbox, resolve all these things. And that's why first time meditators are just flooded with 100 thoughts. And, then all of a sudden we say, oh, we can't meditate. I've just got too many thoughts. All those thoughts are just your inbox. So you've just got a really full inbox of unresolved things that your unconscious mind wants to resolve. So the more we meditate, the more we can actually resolve these things, and then eventually get down to inbox zero. And that's when the real beauty of meditation kicks in. Once we've cleared our inbox and we've resolved these unresolved emails in our mind, then we can really get down to that beautiful restorative place that transcendental meditation talks about, and many other forms of meditation describe, where it's even more relaxing than a sleep. It's just really, it's profound. It's really powerful. And another way, so just going back to what you were talking about around anxiety, one of the tools that I teach to my friends even before I started coaching, is something I've used as well. Sometimes I can get anxious, in social situations or something like that, is 4-7-8 breathing. So it's really simple. Dr. Andrew Weil popularized it. I think originated from ancient classical yoga practices. But basically the way it works is you breathe in for the count of 4 through the mouth, you hold it for the count of 7, and then you breathe out through the mouth for the count of 8, and you do that 4 cycles. And on the last cycle, you just completely exhale and then bring yourself back to just your normal rate of breath. And you'll find that every time you do it, just whatever anxiety you've got, it just completely dissipates. And it's such a beautiful feeling. So I'd really recommend people check that out. You can just look it up on YouTube if you forget how to do it. 4-7-8 breathing. It's a really powerful tool.
Yeah. It's interesting because you're basically using your vagus nerve there, which is innervating your diaphragm and your intercostal muscles. And, that's you taking control of the vagus nerve, which is, the autonomic nervous system. So it normally happens subconsciously, but then what you're doing is you're taking control of it consciously. Yeah, so understanding our physiology is really interesting, and helping our own physiology, to detox our mind and detox our body is great. So, it does give you that feeling of empowerment. Like you wake up in the morning, you go, well, I'm going to drink a big glass of water and I'm going to have some fresh lemon in it, or maybe some ultimate superfood, and I'm really helping my liver and my gut there to eliminate toxins. And that can really relax you for the whole morning. And then, choosing a lunch that's high in protein and high in healthy fats, and a salad, which is going to help your liver. That can really relax you for the afternoon and reduce cravings for sugar, because sugar is something that will disturb your gut microbiome and then release toxins from the wrong bacteria, which could cause anxiety. So, you know, for people with this chronic anxiety, which is a very common problem, they need to take more control of their physiology as well as their psychology, and then they'll find that they can relax in the fact that they've got that increased control. And that's great because, I mean, who wants to rely on Valium, you know, taking sedatives or alcohol excess to relax? If you can know how to relax yourself, and there's so many techniques that people can learn with your help, and, you know, reading my books. I've got a very good book on help for anxiety and depression. I think that ability to get more control over your physiology and your mental state is so empowering. It's so liberating for people. And that's really what we should concentrate on. You know, the old paradigm of people going to a psychiatrist and that the psychiatrist will heal them and give them all the techniques that they will be able to cope with life is really outdated. Sure, we need psychiatrists, but, you know, recently all the psychiatrists in the public hospital system in Australia went on strike. So, you know, imagine how their patients felt, people with chronic emotional problems or mental illness. All the psychiatrists have gone on strike. What are you going to do? You have to rely on yourself. And learning that ability to rely on yourself successfully, to have those techniques, is so wonderful, so liberating, and it's possible. You know, you just need the right mentor. And that's what we're going to help people with, Igor.
Definitely. And knowledge is power. You know, like it's something I learned through. I've had insomnia in the past. Something I've battled with. My sleep's pretty good now, but it still happens sometimes. Is when I've have a bad sleep, I know that I'm likely to crave unhealthy food, and that's common amongst So knowing, and then I know that when I fulfill that craving, then you know, like you said, my anxiety goes up, and then I end up that affects my sleep the following night. So it's up to me to break that cycle. I can go, okay, I feel that craving of unhealthy food, but instead of that, I'm going to have something healthy. I'm going to, you know, go back to good practices, maybe do some 4-7-8 breathing, go for a walk, go for a run, exert myself, actually tire myself out. So then that night I actually get a good sleep.
Yeah, exercise. Exercise boosts your endorphins. That's proven categorically that if you exercise, you'll increase endorphins, and endorphins are happy chemicals, and they will relax you. Now, we've got Katie here who's trying to stop smoking, or maybe she's trying to help somebody else stop smoking. Yeah, well, smoking, of course, is highly addictive. Nicotine is a great chemical. It makes you feel fantastic. But, you know, it's the chemicals in the cigarettes which are so toxic and will cause cancer and inflammation. So how do smokers stop? Well, if you like nicotine and you don't want to give it up, you can try nicotine lozenges. They're fairly harmless. You can get nicotine spray. And I'm not talking about vaping. Vaping damages the lungs. But you can get a nicotine spray and you can spray it into the back of your throat. Now, nicotine is a nootropic, so it stimulates the brain and it can give you energy. And nicotine in itself is not dangerous or not harmful. But if you take too much, it might make you a bit anxious. So anything you can do to stop smoking is wonderful. And, you know, I find that if you let people use the nicotine lozenges or the nicotine spray, it really helps them. And then, you know, just learning techniques such as meditation can help you to reduce your ingestion of nicotine. So there you go. Hope that's helpful for you, Katie. And then there's somebody called Joanne. Hi, Joanne.
Oh, from last week. I remember Joanne.
Oh, yeah. How do we activate our vagus nerve? Well, Igor talked about meditating, breathing technique. So slow, deep breathing where you sit down in a quiet place, you close your eyes and you just focus. Breathe in deeply and then breathe out. And when you breathe in, you're feeling your strength. And then when you breathe out, you're letting go of the stress. You breathe in, you feel your strength. You breathe out, you're letting go of your stress. So you're taking control of your vagus nerve there, and you're telling your vagus nerve to breathe in, so your diaphragm goes down, and then breathe out, your diaphragm goes up. So that's probably the best way. But just looking after your vagus nerve, don't eat too much sugar. Sugar damages nerves. Sometimes people who get herpes, they get cold sores or shingles, the vagus nerve can be invaded by the herpes virus. So taking a good selenium supplement will reduce the amount of the herpes virus in your nerves, including your vagus nerve. I've had patients who've had severe damage to their vagus nerve from the herpes virus, and they often get a lot of cold sores or shingles. You give them selenium, it repairs the vagus nerve. So that's an interesting tip for you. I've been using selenium in patients for many, many years, a wonderful mineral. There you go.
So I was just going to ask, how do you actually, how do you test the health of your vagus nerve? Is there something you can go to your GP and test that?
Well, the vagus nerve, it innervates so many things in your body. It innervates your vocal cords. So if you've got a hoarse voice or you've lost the strength in your voice, that could be the vagus nerve. If your diaphragm's not moving properly, you could have damage to the vagus nerve. If you've got digestive issues, perhaps the vagus nerve is not sending the right signals to your gallbladder or your pancreas, or you're constipated, or you've got irritable bowel. That can all be the vagus nerve, but the vagus nerve is incredibly long. So there's not one specific test that, the doctor can go, well, I'll put an electrode here and test the flow of electricity through the vagus nerve. That's pretty impossible. But it's more the symptoms. Like I had a patient once, she was a really interesting lady, and she'd been to an ear, nose and throat specialist. And this is because she lost her voice and she was also short of breath. So the doctor had a look at her vocal cords, and one of them wasn't moving. That's why she couldn't sing anymore and her voice was weak. And also he looked at her her diaphragm, and one of the diaphragms on the right side of the body was not moving. The left diaphragm was moving normally. So the right vagus nerve had been damaged. It was not innervating her right vocal cord or her right diaphragm. And I said to her, well, do you get cold sores? She said, yeah, I get a lot of cold sores on the right side of my face. I said, oh, you got the herpes virus in your right vagus nerve. And she'd had these problems for over a year. So I gave her selenium, 400 micrograms a day, which is a big dose, and within 3 months she was cured. So usually you go by the symptoms. If you've got symptoms that the vagus nerve is not working properly, it could be that you've got damage to the vagus nerve from diabetes, too much sugar, you're overweight, you're not exercising. Everything impacts the function of your nerves. But I'd say sugar and viruses are the most common reason that people have damage to their vagus nerve. There's other reasons too, but we won't go into too much detail. Maybe we'll do a whole webinar on the vagus nerve. It's such an interesting nerve.
Yeah,
Isn't
it's
it?
fascinating.
Yeah.
I look forward to that.
Yeah.
I was just going to mention before when we were talking about when Sandra, you were talking about just how answering the question of calming the vagus nerve through deep breathing. It's quite interesting. Like one of my close friends is a heavy smoker, and she experiences anxiety, and she finds that when she smokes, she's able to breathe deep, and that calms her anxiety. So it's not even necessarily the nicotine. I mean, sure, the nicotine as well, because you're calming the addiction of the nicotine. But I think one of the other benefits she gets is actually having that time and space to breathe deeply. So, I mean, I hope one day she kicks the habit, because, she's a good friend of mine. So I want her to be around until we're old, into future years. So, but yeah, I think that's one thing that often many smokers get from it, and which once they kick the habit, they can actually just replace with just going outside and doing some deep breathing. It's essentially the same thing, just without the harmful chemicals.
Yes, that's right. Look, anything you can do to stop smoking, even if you use a nicotine spray or nicotine lozenges, but it's really, well, we've got to understand, why you're using nicotine to help with anxiety. There's so many other things you can do, and working on your vagus nerve is fantastic. It works, and even when you take magnesium, well, that's helping your vagus nerve. Magnesium helps to regulate the electrical flow through the nerves. It helps to stabilize the flow of electricity through nerves. It's very calming. Or, just going ketogenic with your eating patterns can reduce anxiety. So you need a holistic approach. You need to do everything you can, because, smoking is just so bad for you. And
I just wanted to, sorry, go ahead.
Yeah, so you've got to really look at everything you can do, and it comes back to your habits, and it's the little steps that you take, and even if you're not motivated, you've got to look at persistence. Persist with those little steps, and you'll find that you get better at it.
I just wanted to ask you, Sandra, in regards to selenium, it's something that my functional medicine doctor prescribed to me once we did all the tests of, back when I first developed my autoimmune condition. It's prescribed to me to eat 5 Brazil nuts a week. And then when I spoke to you about that when we first met, you mentioned that that's still inadequate. So and that's something that I've learned through my journey of like functional medicine and regenerative agriculture, is we've stripped the soils to the point where even the foods that are typically high in selenium still don't have anywhere near as much selenium as they're used to. So we're chronically selenium deficient. Is that true?
Yes, and blood tests don't necessarily show you, because most of the selenium in your body lives inside your nucleus. So, every cell, except for red blood cells, has a nucleus. And in that nucleus is our DNA. And our cells are very intelligent, and they're programmed to accumulate the mineral selenium in the nucleus. Why? Because selenium repairs damage to your DNA. And it also programs your cells to fight viruses. So you can do a blood test and it may show that your selenium is normal, but inside your cells, you can be very deficient in selenium. So a blood test is not very accurate. And if somebody wants a blood test for selenium, they need to stop taking selenium supplement for 7 days and then have the blood test. Because the blood test is only going to tell you if you've been taking a selenium supplement, and if you're absorbing the selenium into your blood. It's not going to tell you if your cells have enough selenium inside them. Now, Australian soils are very, very low in selenium, and indeed in the southwest, Western Australia, if farmers do not give selenium to their sheep or cattle, they don't reproduce, and they get white muscle disease. They can't walk. So most farmers in Australia will give their animals selenium, or they're just not successful in breeding. in large parts of China, there's terrible selenium deficiency. And there was a very good study done in China with 38,000 people with hepatitis B virus. And they found that in the group that were supplemented with selenium, the incidence of liver cancer caused by the hepatitis B virus reduced by over 40%. It was a very large study. So you can be selenium deficient. And how do you know? Well, your immune system won't be strong. You'll be prone to viral infections. You'll have an increased risk of cancer, an increased risk of inflammation, autoimmune disease. And you may have a lot of cold sores. You may find that you get recurrent shingles. So, I use selenium in many, many patients to basically just help their immune system. It's a fascinating mineral. And another thing it can help is cardiomyopathy, and that is a disease of the heart muscle. And it's not rare. So what happens with the cardiomyopathy, the heart muscle becomes inflamed and weakened, so people go into heart failure. And there's a particular type of cardiomyopathy called Carson's cardiomyopathy, and it only responds to selenium as an effective treatment. And this is because the cardiomyopathy is caused by a virus that attacks the heart muscle. But I think it's also a bit autoimmune. But it's a fascinating mineral, and definitely I think, we should talk more about selenium in our live streaming because it can help so many people. And as you said, they don't really know that they're selenium deficient. Yeah.
So I guess my sort of brings up in my mind two questions. First of all, how do you know if you are selenium deficient, if the tests are inadequate? And secondly, can you get enough selenium from a healthy diet?
Look, if somebody has a chronic health problem, they're getting recurrent infections, they have Lyme disease, they have autoimmune problems, I would always give them selenium. Some people worry that it's toxic, but, as long as you're not taking more than 150 micrograms to 200 micrograms a day, it's perfectly safe. I have never seen selenium toxicity. So I would use it routinely. I wouldn't rely on a blood test because we know that that's not a reliable indicator of your total body selenium status.
And how can you my second question was if you eat a healthy, balanced, nutritious diet, can you get enough selenium from that, or do you still need to supplement?
Well, it depends on the individual, but we know that in large parts of Australia and China, and with overpopulation of the planet now, I'm sure there are many other countries that have selenium deficient soil. So, if the soil is deficient, the food will be deficient. I mean, I grew up in South Australia and I had warts all over my hands and they were quite painful. And I didn't know that it was related to selenium deficiency. But when I came to New South Wales, I started to supplement with selenium because I started to research this mineral, and within 6 months, all the warts had dropped off. So, there's many areas in Australia that are selenium deficient, like plantar warts. Patients can have chronic plantar warts, quite painful. Well, that's a virus. So that could be a sign that you're selenium deficient. So I don't rely on the diet, no. And there's many things that you may not get in adequate amounts, even if you think you have a healthy, balanced diet. And, in Australia, we have the warning that vitamins and minerals can only be of assistance if the dietary intake is inadequate. Well, what does that mean? I mean, the diet of people varies tremendously. If the food is depleted in minerals and vitamins, which it can be for many reasons, or if you have a dysfunctional digestive system where you're not producing enough bile or pancreatic enzymes, or you have an inflamed gut lining, are you going to absorb all the nutrients from a healthy diet? It's a very complex subject. And, people can go to a naturopath or a doctor and get advice. But the good thing about nutritional medicine is vitamins and minerals are generally very safe. And I have never seen selenium toxicity, for example, but, you can always email my health advisory service through the Cabot Health website or the Liver Doctor website, or go to a professional and get advice. But if you're not getting better with the advice you're given, don't give up, look elsewhere, because nutritional medicine is very, very powerful and it can help people with chronic health problems. And often people are deficient. We do a lot of blood tests and urine tests. We find people are deficient in iodine, they're low in vitamin D, they're low in vitamin C, because these nutrients you can measure accurately in a blood test. But there are some minerals that blood tests do not accurately measure, such as magnesium and selenium. So we can just become aware of the therapeutic value of these simple things and how we can use them in our life.
Definitely. I just realized we've hit about an hour, so we should probably wrap it up.
Yeah.
I could keep talking for hours with you, Sandra. You're just a wealth of knowledge, and every time I'm just learning more and more. So thank you for sharing your wisdom.
Really interesting. We like sharing case histories. Because that's how people learn. They go, yeah, I can relate to that. I've had that problem, and gee, it worked for that person. So yeah, I love sharing case histories. I mean, they're only anecdotes, but still, they're real. Yeah,
and there's lots to be learned.
So many good clinical trials happening now that are being published in reputable medical journals that we can share as well.
Wonderful.
Great.
Yeah, I think it'd be good to do a deep dive maybe in a future episode around what are some common things that people may not get enough of from their healthy diet that maybe they should consider supplementing.
Yes, and the things that will impair your absorption of vitamins and minerals, because you may think that you have a fantastic healthy diet and you're putting in a lot of effort to eat well, but if your gut is not working properly, you don't have enough stomach acid, you don't have enough bile, you don't have enough pancreatic enzymes, you've got the wrong gut bacteria, you may not be absorbing the nutrients. So all your wonderful efforts are not reaping the rewards that you should be getting. Yeah.
Yeah, fascinating. Yeah.
Great.
Cool.
All right. Well, thanks for your input today, Igor. And we might start changing the time of some of these webinars too, so that people can listen to us in the evenings.
I think maybe we could do a poll.
Yeah,
I'll set that up with. I'll set that up with some of your staff, and we can run that on social media and see what's the most popular time slot. Maybe lunchtime could be a good one, because then that way people who are home during the day maybe work at irregular times. People who aren't home who are working, more often than not, they'll still take lunch. So that could be another option. Yeah.
True. Beautiful. Okay. Well, we hope you've enjoyed this podcast, and we look forward to seeing you again. Send us your ideas, what you'd like us to discuss.
Thanks, Sandra, and thanks everyone who commented, and thank you for watching.
Yes.
All the best.
Well, thanks for being part of our webinar. If you have any questions or new topic suggestions, email us at support@liverdoctor.com. And don't miss our next webinar, Be sure to follow us on social media and subscribe to our newsletter at liverdoctor.com. Bye for now.